We are going to start, as we normally do, with the COVID-19 situation here in South Korea. The country is seeing an uptick in new daily cases, as we usually witness cases increase like this toward the middle of the work week.
However, authorities forecast that infections will begin to drop in the coming weeks. As they say, South Korea has passed the Omicron peak. For more, our reporter Choi Min-jung is here in the studio with us. Good morning, Min-jung.
Good morning.
So tell us, what are we expecting for today?
Mok-yeon, we're seeing another uptick in cases. From midnight to 9 p.m. Monday, we saw close to 334,000 newly confirmed cases. This is a jump of around 150,000 cases from the same time the day before. As always, the uptick is partly due to increased testing on Monday after a lull in tests over the weekend. Authorities on Monday said that the Omicron wave has passed its peak, and they forecast that daily infections will drop to less than 300,000 within the next 2 weeks. And they were also optimistic that cases will fall below 200,000 within 4 weeks. With this outlook in mind, authorities appear to be considering whether to relax the current social distancing rules from next week. Under the current rules, gatherings are allowed for up to 8 people, and most businesses must close by 11 p.m. And they will last until this Sunday.
Okay, that's good to hear. And we normally hear about how they will be revised on the Friday prior to the rules changing on Sunday. So we're seeing a general downtrend in new cases, but what about people who are severely ill as well as the number of deaths?
Well, the peak has passed in terms of new infections, but that's not the case for severely ill patients and deaths. Authorities have said that figure could peak in the next 2 or 3 weeks, and we're expected to see around 1,300 to as many as 1,680 patients in critical condition. And authorities predict that figure will drop sometime in April after reaching its peak. Officials are especially on high alert with cases increasing among seniors and with the rapid spread of stealth Omicron, which now makes up more than 56% of infections. With this in mind, authorities are continuing to keep the country's pandemic risk level at its highest point, unchanged for 4 straight weeks.
So Min-jung, like you just said, stealth Omicron is now the dominant strain here in South Korea, and authorities are warning that there could be more new variants coming in.
That's right, Mok-yeon. KDCA Chief Choi Min-jung warned there is a high possibility of a new mutation of COVID-19 spreading at any time in the future. Jung referred to the so-called Deltacron, which is a variant that contains elements of both Delta and Omicron. And she said that new variants like Deltacron could be detected in the country at any time, given South Korea's widespread pandemic and other regions in Europe, Brazil, and Thailand already reporting such cases. She added that the new variants do not pose significant threats to the current efficacy of vaccines, but said it's crucial to remain vigilant and be prepared to take action in the event any new mutations arise.
Okay, and in regards to treating patients with COVID-19, we hear that South Korea has secured more supplies of new drugs.
Right, Mark. South Korea has purchased an additional 200,000 courses of Pfizer's Paxlovid. With those extra pills, the country has now secured enough Pfizer pills to treat 962,000 people. The country had also previously signed a deal with MSD for 242,000 courses of Lagevrio. So now, a total of more than 1.2 million courses of pills will be available for use in the country. As of now, Paxlovid has been prescribed to 127,000 people, and Lagevrio was prescribed to 500 people over the weekend. Prescriptions for Lagevrio began to be issued on Saturday, and the drug is currently being used to treat patients who are unable to take Paxlovid for health reasons.
All right, Min-jung, thank you so much for your report. We'll talk to you again tomorrow.
Thank you.